Cervical spine surgery, anterior cervical discectomy and fusion, most common surgical procedure on the cervical spine followed by a cervical disc arthroplasty and posterior and anterior cervical foramen anatomy. The effectiveness of cervical spine surgery on radicular pain is moderate to good. A patient can experience dysphagia after cervical spine surgery mainly with anterior cervical approach. Majority have improvement of symptom over 2 months, but in some patients significant pharyngeal impairment persists, and for those specific rehabilitation is needed. Considering the high degree of limitation and deterioration in quality of life that dysphagia can cause, studies are needed to explore the best measures and most effective rehabilitation approach. During the immediate postoperative period, reduced neck motion due to fusion, pain and postoperative immobilization, which can lead to decreased neck muscle function and persistence of symptom in many patients after surgery. The atrophy and deconditioning of neck muscle function can persist over time. Postoperative rehabilitation starts at 4 to 6 weeks after surgery. In the meantime, use of bracing can be advised depending on the surgical technique, given that the use of rigid cervical collar for 3 weeks can decrease pain and disability after non-plated discectomy and fusion. Lumbar disc surgery, discectomy or microdisectomy. Patients with lumbar disc herniation are usually between 30 to 50 year old and productive member of society, making surgery important in order to allow patient to return to their previous activity. Discectomy is the most common surgical spine procedure. Discectomy is the most common surgical spine procedure performed in patients with lumbar disc herniation who experience low back pain, most often accompanied by leg pain. Rehabilitation starts at 4 to 6 weeks after surgery, contributing to improvement in disability, pain, and physical function when compared to no treatment. High intensity exercise protocol leading to faster improvement when compared with low intensity exercise program related to improvement of function of pelvic, hip, and trunk muscle. Comprehensive physical therapy intervention are effective in improving muscle function, pain, disability after lumbar disc surgery. These multimodal intervention consisting of wide variety of active rehabilitation technique, including combination of education on performance of daily function task, functional weight bearing, cardiovascular endurance exercise, lower limb strengthening, lumbar stabilization exercise including stretching and strengthening.